The next sign that you may have a deficiency in magnesium is if you're experiencing a constant sense of anxiety or hyperstimulation in the brain, or kind of a lagging irritability that doesn't seem to be resolved by anything. I would say in practice, this is the most common thing that I see in relation to patients having a magnesium deficiency. Magnesium is required in the brain to help with regulating the glutamate. Glutamate and GABA. Glutamate is the excitatory neurotransmitter and GABA is the inhibitory neurotransmitter. And so magnesium is required to bind and block what's called the NMDA receptor, where glutamate can bind and then cause neuronal excitation. This is required for energy and for learning and neuroplasticity. But when it's unchecked and unregulated and in excess, not only can it be bad for the brain because of the overexcitation, but it can lead a patient to feeling like they have just a constant switch on that they can't switch off. They're unable to relax. And that's where that kind of anxiety can come from, and that irritability can be driven from at the root cause. And so I see that quite often with patients. And once they have the proper amount of magnesium in their body, that sense of anxiety is often reduced quite substantially. I would say as well that patients are often misdiagnosed for a serotonin imbalance when in reality the root cause was possibly a magnesium deficiency. That's not to say that that's every patient, but I will say that massive anxiety reductions have been seen in patients supplementing with magnesium.